realistically, where are we going with universal health care?
Where are we going with universal health care? It's hard for me to predict from outside the Beltway just what's going to happen inside the Beltway. I'm convinced that the president's health care plan will never be accepted by the United States Congress. And the reason for it is not because of universal health care. I support universal health care. The reason for it is because he was in favor of a government takeover and management of the healthcare system. The same philosophy that Ted Kennedy has been selling for the last 32 years, which is that government and money can solve our problems. And if we've got healthcare problems, why then we have to put government in charge? In my view, nothing is further from the truth. Government can't run government very well, let alone run 1/7 of our economy. The real question then is, how do you get to universal health care? How do you get there? In my view, you get there through incentives, changing the rules of insurance, and subsidy, as opposed to saying we're going to have government manage the healthcare system and mandate what has to happen in the employment sector. So what would I do to help to get to universal health care? I provide subsidy for people who don't qualify for Medicaid but are too poor to be able to purchase insurance on their own. I would require every employer to join purchasing pools and offer to their employees as many as 3 different options: a managed care plan, an indemnity-based plan, and a catastrophic care plan. I would couple with that catastrophic care plan a medical savings account, allowing individuals to put money aside tax-free to allow them to pay for the deductible or co-payment in a catastrophic care program. I'd also make health insurance deductible for individuals and small proprietorships as it is for corporations. It is not today. I would also say to corporations that are providing health insurance, you cannot discriminate in rate between the large pool, the large corporation, and the individual or the small company. Those changes, I believe, combined, will get our coverage almost up. We'll get well beyond the 90% level. And then I'd look at who is not covered and say, how do we get that last group covered? And I'd consider a wide range of alternatives at that point to say, how do we get that last group covered? Because I'm convinced every American deserves coverage, and we're only going to really solve the spiraling rise in healthcare costs if everybody is part of a healthcare system instead of one where some people are left out and therefore costs have to be shifted to them. Well, look, you all got to go to work. I know it's after 9. I've blabbed on too long. I'm going to get everybody in trouble here if I keep this up, but I appreciate the chance to speak to you. I know that, well, I have to tell you, one of the highlights for me this last year was watching Kevin McHale's retirement. Did you see him in the Boston Garden? His jersey was hoisted to the ceiling, and I thought, what a terrific thing that is, to give him that great honor. Then I noticed the number on his jersey, number 32. Ted Kennedy's been in 32 years. It's time. You've got the message. You've got the message. It's time for another great retirement party in Boston Garden. Thank you very much.